Prostate cancer is one of the most common cancers in males, and thankfully treatment has come a long way, which allows the 5 to 10 year survival rate to be over 95%. One of the main treatments is a surgery called a prostatectomy. My name is Kelly, and I'm a physical therapist that specializes in cancer rehabilitation as well as lymphedema. And today in this video, I'm going to share the recovery process for prostatectomy and the side effects that we can address in cancer rehab in order to get back to doing what you love to do. Before we begin, make sure that you subscribe down below for weekly new videos. You can also follow along with us on Instagram or check out my website for more resources. Everyone's surgery and procedures may be slightly different, and everyone is unique. So your surgeon will provide specific guidelines and a protocol for your recovery based on your own surgery and medical needs. And know that I am sharing a general recovery process for education purposes only. For more personalized questions, be sure to reach out to your medical team. First, after surgery, many stay in the hospital for about one night. During this time, the nurses and therapists will help you get moving shortly after your surgery to make sure that we're getting blood flow and preventing blood clots, and to get the muscles stretched and to keep you strong. Your doctor will discuss pain management before you go home so that you're comfortable for your first few days at home. After about 1 week, when your surgery site starts to heal, the catheter will be removed. This is typically done about 7 to 10 days after surgery. Many will have this done in the doctor's office, but in some cases this may be done at home if the doctor provided clearance and instructions. Know that urinary control may take weeks, months, or even a year to fully return. A pelvic floor physical therapist is a wonderful person to see to address these concerns early on to help speed up this process. There are research studies that have found that those who get the support and help in therapy sooner, especially before radiation, the better the outcome is long term. Pelvic health therapy is growing rapidly, and you can search around or speak to your doctor for a referral for one in your area. Now, when it comes to exercise, doctors often recommend to avoid any strenuous activity or lifting heavy for around 4 to 6 weeks after surgery. Gentle walking and movement is still important for blood flow and to maintain muscle health, but it'll be kept light and gentle so we avoid from overdoing it. After about 4 to 6 weeks, many tend to find themselves back to doing what their regular activities were, their exercises, and their hobbies again. If someone is placed on androgen deprivation therapy long-term, or what we call ADT, which is a form of hormone therapy, then it's incredibly important to work into a strength and resistance training program. ADT can cause muscle weakness. So starting a strength program is essential to maintaining that good strength over time. In cancer rehab, this is something that we work on with our patients all the time. We want to help build them up in a safe way with a program and help create or find a program that they can continue with long term to maintain their strength, their function, and their overall health. Many are able to resume sexual activity after full recovery from surgery. If someone had a radical prostatectomy, full recovery of erectile dysfunction may take weeks or even up to 1.5 years for some to fully recover. This is also something, though, that a pelvic floor physical therapist can help address, especially to assess and treat any pelvic floor muscle issues or dysfunction. It's also important to address this issue along with the urinary incontinence prior to radiation if able, to allow for better long-term outcomes and recovery. But if someone has already had radiation, it's not too late to get help. It's still something you want to look at doing. Recovery from surgery does take time, but the good news is for many that these side effects are temporary. There are other side effects that may occur, but these are the main side effects that we see day to day. If you have any personal questions or concerns, the best person to speak to is your doctor or surgeon for medical guidance. If you have any other topics that you'd like to see covered in this upcoming video or anything else on prostate cancer or other cancers, please comment those down below, and I hope to see you all in the next video. Thanks, everyone.